Singabakho Nxumalo speaks on behalf of the Department of Correctional Services. To this now, Pfizer and BioNTech have reached an agreement with the Biovac Institute in Cape Town to produce COVID-19 vaccines in this country. Biovac says it will submit the vaccine to the regulator next year and expects mass production by 2023. Its CEO, Morena Makwana, gives us the details.
It's going to be a 12-month process between now and when we submit to the regulator. So, take it from about a year from now, we will be able to start the manufacture. Obviously, starting with some small volumes, just so that we make sure that we're very careful. I mean, vaccine manufacture is a very delicate process. So we're thinking that by Q3 next year, so exactly this time next year, we are hoping to be able to commence manufacture and, slowly ramp up, for the second half of 2022. But in 2023, that's where we're hoping to really now go full blast, That's where we really need to be pumping quite a lot of doses.
Well, Makwana also says COVID-19 will be around for a long time, and the vaccines Biovac will manufacture are a long-term solution to the pandemic. He says the aim is to tackle severe symptoms and avoid hospitalizations.
Unfortunately, I have sad news in that the virus is not going to go away. If anything, we may even get more variants. So the virus will still be there, which essentially means that whatever effort that we are doing now is long-lasting. The virus is going to be with us just like flu is with us, and SARS-CoV-2 is going to be with us. And so all we need to do is to make sure that most people get vaccinated, but the virus will still be around. And what we need to get to a point is so that we are vaccinated enough so that when we come across a virus, that we don't get as sick or people don't get hospitalized. That's the best that we can do with the current data that we have now. But the virus, unfortunately, is not going away.
Morena Makwana is the CEO of the Biovac Institute, which is based in Cape Town. Let's stay with issues to do with vaccinations and COVID-19. The COVID-19 vaccine rollout is picking up speed again, with more than 257,000 vaccines administered yesterday. Almost 10,000 miners at Sibanye Stillwaters have been vaccinated. Let's take you to eNCA reporter Heidi Giokos, who is in Western area, finding out more. Let's talk to her live now. And Heidi, the mining sector, in as much as the vaccine strategy of the country seems to have shifted from a sector-specific strategy to, one that's based on demographics, the mining sector, however, continues to be one of those sectors that were always going to be targeted because of the congregation of people in the work environment. Tell me about the work that is happening at Sibanye Stillwater in as far as vaccination is concerned, and trying to ensure that as many of the mine workers as possible are vaccinated in as quick a time as possible.
Yes, certainly, and I think what's key here is the fact that Sibanye Stillwater approached the National Department of Health to say, given the environment workers are exposed to and work under, it is extremely crucial for them to be vaccinated as quickly as possible. When we spoke to a miner earlier on, Tulas, he indicated to us that when they go underground and they go into a cage, to go underground, it's about 50 people plus in that particular cage to go underground, and he says it's very difficult to social distance, and this is why it's so important for them to be vaccinated as quickly as possible. But we know that this process is running quite smoothly. We know 80,000 workers have been targeted and just under 10,000 have already been vaccinated. The goal is to vaccinate at least 70% of the workforce and then start moving into the communities and dependents of the workers. As of course workers go back home, they expose their families and their communities. So we do understand that they are hoping to achieve this in the next 2 to 3 weeks, and then they'll start moving into the community. It's quite a smooth process to us. There are about 3 tents, screening, registering, and then moving over into the waiting area. There are about 10 vaccinators. If needs be, they'll get more vaccinators, and we do understand understand that they administer about 600, possibly 1,000 vaccines per day at this particular vaccination site. But let's listen to the COO of Sibanye that just speaks a little bit more detail as to how the process unfolds.
As a company today, we've got 4 sites, primary sites, that have been recognized by the DOH. Each of those sites can administer in excess of 500 vaccinations a day. And we're busy rolling out a further 4 satellite sites, which will also do in excess of 500 a day. And really our capacity is constrained mostly by the number of doses we get and feet we can get through the door. So we certainly look forward to rolling that out more aggressively in the coming months, and certainly supporting the national vaccination strategy as we move forward. We have about 80,000 employees in our company, including contractors. That'll certainly be our initial focus for offering the vaccination to. As it stands today, we have currently vaccinated just under 10,000. Once we've got through a lot of our own employees, we certainly look forward as well to rolling out this program to dependents and families, and then ultimately the communities in which we operate. So I do think we have the ability to certainly play a significant role in assisting with the program.
So Heidi, I suppose this is part of the public-private sector partnerships coming into play, because for a long time there was that debate of what role exactly the private sector can play in the issue of vaccinations, and particularly those companies that work, that have congregant settings for their employees. Just locate this, the activities at Sibanye-Stillwaters within that context, the workplace, vaccinations, and the degree to which the government, the National Department of Health, is now encouraging that to happen more and more.
Yes, so what we understand from the Department of Health is that workplaces need to approach the Department of Health, provide a clear database of how many workers are within that particular workplace and how many are expected to get the vaccine. The Department of Health will then do an assessment and make sure that there is a vaccination site that is allocated to a specific workplace. For example, here, Sibanye-Stillwater, and any mine office or workplace has, health and safety and occupational health, where they actually have health on site and they actually have nurses, doctors. So it was a lot easier for this rollout to happen here at this vaccination site. So people did not have to go out to various vaccination sites. The vaccination site was set up here. What's interesting, though, to us is that according to Sibanye, there is a little bit of a concern. They would have wanted to start vaccinating a lot more people and speed up the vaccination rollout progress, but it's all dependent on how many vaccines they receive. And given the shortage that the country is experiencing, and because we are starting to vaccinate a lot more sectors and more age group categories are opening up, they have been told that they're a little bit short on the Pfizer vaccine, so they are going to wait to get more of those vaccines. And as vaccines become available, they will be able to increase vaccines administered here at these Sibanye-Stillwater vaccination sites. So a lot of the workplaces approach the Department of Health to say, we need to get our team vaccinated as quickly as possible because of the exposure, because of the close proximity that people work together. And then the Department of Health will give the green light and say, go forward and do this. You don't need a vaccination site because you have your vaccination sites. We'll deliver the vaccines. What's also key here is the fact that vaccines are, of course, delivered here. High police presence, we understand, large security contingency to make sure that those vaccines are secure, because it is quite a distance from the Biovac facility. But it's quite an extensive process, and it's quite amazing to see how quickly people can get vaccinated once the private sector gets control of their vaccination sites.
Yeah. All right. Thank you for that, Heidi. And it sets up the conversation nicely with Dr. Nicholas Crisp, especially the issues about the supply chain of those vaccines. If you have private sector sites like the one you are at Sibanye-Stillwater saying that we would have liked to vaccinate even more people, but in terms of the supply, we're sort of lagging slightly behind. And I suppose that's a factor, Heidi, of the demand right now possibly catching up to the supply, if not outstripping it?
Yes, certainly, and I think this is something that the Department of Health is fully aware of. We know that the reason why, one of the reasons why our vaccine rollout was so delayed was because there was such a shortage and the country was not able to secure vaccines as quickly as it would have liked to. And now with the demand so high to us for people to get vaccinated and workplaces saying, we need our staff to get vaccinated. We need them to start contributing to the economy again. We need them to start getting to work again. The Department of Health is going to need to manage that as quickly as possible to make sure that they don't run out of vaccines, especially those that need to get their second dose of Pfizer, but also to allow workplaces to vaccinate even more staff and move into the communities, as we've seen here in the mining sector, where it's so crucial for not only workers to be vaccinated, but also the people they go back home to, the people they are exposed to, and those that are also vulnerable. So hopefully the Department of Health will be able to manage that, but we know for now there is no shortage. They are managing the vaccines that are rolling out, but hopefully they'll be able to increase that supply chain that you speak of, Tulas.
All right, thank you for that, Heidi Giokos. She's been doggedly tracking this story around vaccinations, and I know that I can throw any question at her because she has been watching, excuse the pun, all angles of this story.